On my way to work each day, I travel the interstate highway. It's an easy commute, but when something goes wrong and I have to take a detour, it messes up my whole day. It's the same with our bodies. The spine is a superhighway from our brain. When there's an interruption, it can mess up your whole system. That's why Dr. Craig Livesay from the Spinal Corrective Center is here with a new way to stay well adjusted.
Well adjusted.
Welcome.
Thank you, Morgan.
So today we're talking degenerative joint disease or degenerative arthritis. Are they the same?
They're pretty much the same thing. A lot of patients, they come into my office, they've been diagnosed with degenerative joint disease, degenerative disc disease, osteoarthritis. But one, they don't know how they arrived at that point, and two, they don't know what to do for it. And a lot of patients think they can't be adjusted because they have that degenerative arthritis.
Okay. You've got some show and tell for us today.
Yeah, this is a model that shows a normal, healthy spinal joint, phase 1, phase 2, and phase 3.
So we're showing this is reducing as you go down,
yeah,
the spongy part in between them.
Yeah, and it's not really part of normal aging. This is excess wear and tear. And you talked about the drive into work. This is almost like driving your car down the street with your tires out of alignment. If you hit a couple of potholes along the way in your life, you'll get these small misalignments. And each day as you're going, it's almost creating this rubbing sensation. Just like your tires being knocked out of alignment. So what that will do over a period of time is it will create that arthritis. So what we can do with the Pro Adjuster Ultraline G2 is we can actually help this patient. We can slow down this amount of degeneration, possibly even stop it, especially make them feel a lot better.
And you don't have to do it by putting them on the table and bending them and twisting them anymore, which has a lot of people afraid to even come to a chiropractor. And now you can do it with this little gadget that I'm not even going to touch.
Yeah, probably not. Yes, when you run this down the patient's spine, puts a small impulse in, and we can graph exactly what's going on. But as soon as we hit that segment, let's just use the fixated segment for a second. That's locked up. That's going to be where we'll use this one.
Okay.
That's when that one's going to show there's a lot more resistance. And you'll see at the end it turns out being red.
Okay.
So when we choose that segment, which is C6, we go to treatment. It puts that impulse into that joint. That impulse will free this joint and get it to start moving correctly.
And that's not an electrical pulse. That's just the noise you hear from it just.
Yeah, that's the mechanical pulse that's actually going into the joint, that's actually moving the bone. See, the joint itself has no blood supply, or I should say the disc has no blood supply. It gets its nutrients in and the toxins out by a process called imbibition. That's just the proper movement of the spinal joint. And the reason someone goes from normal all the way back to phase 3 is because that joint's not moving properly.
Okay. And then next week you're going to show us how this thing actually works.
Yeah.
By doing an adjustment on the air.
We're going to do an adjustment on Morgan.
Painless. Actually, I've had it done. It's kind of nice.
And we got the...
You've got a special?
Yeah, we have the special. It's a new patient exam, x-ray consultation, and your first adjustment, which is $39.
All right.
That covers the whole...
And you can go to your website, coupon there, and you're having something tonight.
Oh, we're going to do a workshop tonight. We do a little continuing education series for our patients in the office. Tonight is how to lose 20 pounds in 2 months.
All right. And one way not to do that is our next segment where we're going to be eating chocolates. Whoop, whoop.
Yeah.
So we'll come see you, and then we'll go see her.